Hello, I'm Iris Sabido. I am the pre-op and PACU manager at Innovate Surgical, and I also take care of the total joint class here at Innovate. It is important for people to take, a joint education session before their surgery because literature demonstrates that patients who attend education sessions prior to surgery have decreased anxiety, better post-op pain control, more realistic expectations of surgery, and a better understanding of their surgery. In addition, this education class does lead to lower hospital length of stay, higher home discharge, and a clear direction for our patients. Before they even come for surgery, people have an improved knowledge of what's going to happen, better health behaviors, and health outcomes at home as well. This is an example of the joint class that I do here. So I'm going to just demonstrate a couple of the slides. So we talk about an agenda, that we're going to talk about the healthcare team, understanding their surgery, how we prepare them, how we transition them home in life after a joint replacement. In terms of understanding the surgery, this is just brief. We talk about, just give them an example, reasons why people have a knee replacement due to crack, wear away, bone rubbing against bone, and just give them an example how the knee prosthesis looks. We also talk about risks for patients just to let them know that, as a patient, they have to be informed of all the risks that they're, even though the risks are minimal. We show them the risk for having hip and knee surgery and also how to prevent them. So in terms of blood clots, we let them know that higher risk populations are the ones that are bed rest. So the expectations that after having a total joint replacement is that they need to be moving, walking every hour, increasing their steps day by day, doing ankle pump exercises, whether they're in bed or on the couch, and as well that they will be sent home with an anticoagulant as simple as aspirin. In terms of infection, which is big, we let them know what we do here to prevent infections in terms of keeping it sterile, inspecting the site. But we also let them know that how they can have better control at home to prevent infections. We let them know that, hey, don't schedule any dental visits 6 months after your surgery. If they have any dental procedure, they must reach out to their orthopedic doctor and possibly be taking antibiotics before. We let them know don't shave, in the case they nick themselves, the importance of hand hygiene, and that to report if they're ill, if they notice any skin rashes, any cuts, instead of finding out on the day of that they're ill and canceling on the same day, we tell them please call, that if they notice any change in their health, they have to call as soon as possible. In terms of the HIPAA cleanse, we explain to them, how to take care of it, the importance of it, and that, getting their house ready, and why is it not recommending to have any pets due to the increase of infection and a fresh incision. We show them more about we talk more in details about the risk, and one of the biggest ones that we focus is on hip dislocation. So in one of the later slides, we talk about, how to prevent a fall, and then we also show them videos on certain movements that they shouldn't be doing at home as well. We also remind them that, a week before their surgery, they should stop all these medications that are listed here. But we also remind them, hey, please don't stop your other important medications like your cardiac medications or medications like anxiety or your medications like your diabetic medications. And then we also let them know that on the day of surgery, what medications they should be taking with a very small sip of water, so there's no confusion. When before they come, we also let them know that start preparing, at home by moving furniture, decluttering hallways, removing rugs. I do let them know that, one of the reasons people do fall home is that their foot or the walker gets caught up on a rug, and then it increases their chance of falling. We recommend night lights, purchasing non-slip bath mats, making arrangement for their pets, and having a clear plan for home cleaning and meal planning. For the day of surgery, we do tell them, hey, usually we schedule to arrive an hour and a half before your surgery to start prepping you. What are the expectations when you get here? That you will be checking in the business office to bring your photo ID and your insurance card. That you will proceed to the pre-op area. Do not bring anything available. Just bring, your glasses, your phone. It's fine. Who they're going to meet during that stay and then we let them know too that during that time, communicate with your anesthesiologist any issues that you've had with anesthesia, any concerns to your surgeon. That is your time to address any issues before the surgery happens. And then what we have planned in how we're going to communicate with their coach and family. We let them know how we were going to have managed their pain and their any discomfort, that we're going to give them a set of medications just to, set clear expectations with them, instead of just dumping so much information on the day of, like, this is for you, and overwhelming them, increasing their anxiety. So we do tell them, hey, this is our plan even before you come. So when they get here, they already had this conversation throughout the Zoom. So when they get there, they understand clearly what's the whole process, and then if they have any questions or concern at that moment. We also talk about the anesthesia nerve blocks that they receive, give them examples, just so they understand that this nerve block is meant for them to manage their pain even when they go home, but it doesn't make them lose the function of walking. And then the expectation that this is to reduce their pain, not completely take off their pain, but make them feel more comfortable, going home. After the OR, we let them know that they are going to be entering the PACU area, which is a recovery unit, and that on average people are here 2 to 3 days, 2 to 3 hours before they go home. And it's funny because some people, say, oh, wow, I usually on this procedure, I stayed at the hospital all day. But no, we let them know that they're going to get light sedation, enough sedation to put them to sleep during their procedure, and when they arrive in recovery, they immediately wake up within like 30 to 45 minutes. The nurse will be next to them, assessing them, monitoring them, instructing them, and starting to teach them in how to walk, how to sit on a toilet, how to get up from a toilet, sit on a recliner, how to use an incentive spirometer, what to expect, and we let them know that before you go home, you do have to do some physical therapy. We have to start testing that new joint. So their expectation that they have to start moving in PACU is already set even before they come. And we let them know about pain management because this is very important for a lot of people. They need to know that there's the realistic expectation is that we cannot promise pain, but we do promise to manage their pain. That the hope that with the combination of the pre-op medications given to them, their nerve block, what's given during the OR, is for them to wake up in that mild category. And so when they're waking up, they understand that this pain that they're feeling is normal. However, if they end up waking up in a severe category, we still tell them communicate with your nurse. Anesthesia team is always around, so we will do promise to help give them a good pain control so they can participate in the therapy and help them get ready to go home. We let them know, again, what's the discharge criteria, that once they go home, that they are to go home and just rest. It takes up to 24 hours for anesthesia to get out of their system. What is the expectation for the coach to just be there on standby to monitor them, to help them, make sure that they are using the walker, doing the correct sequence, that they're taking their medications on time. And then at the end, we do open it to additional questions because the whole presentation usually takes about an hour and 15 minutes or an hour and a half to talk about every single details from every single department. Thank you so much for listening. If you have any questions, we'll be participating in the Q&A. Thank you.